So my name is Robert Wegner. I practice bariatric surgery at St. Francis Hospital. Yeah, I really want to try to give your viewers some factual information about obesity, why it's such a problem for our society right now, how we treat it, and kind of how we got here, and how we talk about obesity in real, not necessarily medical terms, but in a layman's way that people understand it.
Okay, well, speaking of that, why don't you tell our viewers who you are, Dr. Robert Wegner, as it relates to our topic of discussion this evening?
Okay, so my name is Robert Wegner. I practice bariatric surgery at St. Francis Hospital here in Memphis. I only do weight loss surgery. That's my specialty. There's a lot of misinformation about obesity, and maybe you can clear up a lot of the myths and the things that people hear. And everybody seems to be on a diet these days, and how come diets don't work? And you want to come on and talk about that? And I said that would be fantastic. So here we are tonight, and I just want to thank Betty for having me on, and it's a real honor to be here.
Well, I'm honored to have you. Class is now in session.
All right.
Okay, and
live TV. Here we go.
That's right, and you're one of the masters. So let's talk about obesity. What is obesity, and how does you get what is BMI, and how do you match that with obesity to determine if you're obese or not?
So to start out talking about obesity in general, to talk about it intelligently, we need to get away from the habit of casting blame on the obese patient and faulting them for having this disease process of obesity, and saying, why can't you just exercise more and eat less, and why are you so obese? We have to get away from faulting them like there's something wrong with them. That we have to understand that it takes more than just willpower and more exercise and less eating to really make a substantial change in your body mass index, which I'll talk about in a minute.
Okay.
It's clearly a hormonal and metabolic disease. It's just recently in the past few years that obesity, is actually classified as a disease. There's three things that all diseases have in common. Number one, they cause harm or morbidity to the body. Number two, they impair normal functioning. And number three, they have characteristic signs and symptoms that are uniform throughout the disease. So since obesity meets all three of those criteria, it's classified as such. Now, when we talk about BMI, which you brought up, is very important. If you go to my website, which is www.Memphis Weight Loss Surgery, it's all one word, 3 S's in a row, it looks funny, memphisweightlosssurgery.com. On that website, all the things I'm going to talk about tonight are on there, but one of the most important things is there's a BMI calculator. Okay. The BMI is a body mass index. This is how we talk about a person's body mass, whether they're overweight, whether they're obese, morbidly obese, etc. The BMI is a calculation of your height and your weight. It's a kind of a mathematical formula. You can also go to your computer, go to any website, type in BMI calculator, or your iPhone or your Droid all have these apps for just BMI calculator. If your BMI is 35 or greater, you are probably in the surgical category, meaning that all the diets and all the exercise that you can possibly think of doing are probably not going to help you lose the 100+ pounds that you need to lose. All studies pretty much point to the fact that once your BMI is 35 or greater, to really make a significant change, surgery is the number one, if not the only treatment that should be prescribed to the patient. Not to say that you still don't have to modify your lifestyle and modify your portion control, what you're eating, and some exercise, but surgery is the mainstay of the treatment once your BMI is 35. So my name is Robert Wegner. I practice bariatric surgery at St. Francis Hospital.